You got it?
Got it. Yep.
Okay. So it's 9 o'clock. We're going to get started. Hi, everybody. Thank you for joining us. So summer is here. And one of the things, some of you may have already been on vacations already. Some of you may just be planning your vacations like me. So you're really thinking about summer, not about anything else. But one thing you are going to start seeing and having to think about is AEP 2027. So one of the things that Josh and I wanted to start out real quickly about today is thinking about the certification emails that you're going to start getting. And so we just want to remind you of a few dates that you need to start grabbing a hold of and putting on your calendar. So AEP opens up June 22nd. The cost, I'm sorry, AHIP, sorry, opens up June 22nd. The cost of AHIP is $175. Some carriers, will offer a discount for you of $50 if you go through them. So just keep that in mind. And Josh is going to tell you a little bit about doing your AHIP through NABIP.
Yeah, well, I know that Lisa's going to send a list out and everything, and I actually also will follow up with her. I've got a list of NABIP carriers. We know that Paige and Paul are on some of the leadership at NABIP, and he said that so it's going to also come out on June the 22nd. Now, I personally have never uh, completed the NABIP before, but it is cheaper than AHIP. It's $100. Okay, so it's going to be June 22nd, and now the majority of the major carriers, actually all the major carriers, Humana, Devoted, Health Springs, Aetna now's on board. Um, I'm hearing, and Lisa confirmed that Blue Cross Blue Shield is going to take it. Also, Sempra, Advantage, and so most of the Alabama ones should take that. So just remember that you have that. As far as test taking things, just remember when you're doing this, things do change every year. So, some of us, we tend to fly through it. But if you're a newer agent, take the time, check all the changes and things like that. And, you know, it's going to come quickly, but, for the most part, as far as like the AHIP, it doesn't change a lot every year. So just want to throw those dates out there. I know personally we'll be doing some trainings on the best ways to take tests and things like that later on. So we'll see more things come out on that. So we just wanted to share this with y'all.
As far as certifications, I've done this Medicare certification tracker for you. I'm going to send this out to all the agents. Of course, some of the dates have not been put out there, but a lot of your dates have for certifications for the different carriers. You can see these here, so you're going to start getting emails about these. This just might be something that would help you to keep up with them because I know sometimes, you take one and then you think, well, did I do that or did I not do that? So I thought that this might be something that might be helpful for you. Can you all see my screen? Heather, can you see my screen?
Yes, looks great.
Okay. Perfect. So once there's a few that the dates have not come out, like Sempra, maybe Blue Cross Blue Shield, Viva hasn't come out with their exact date. But once they do, you could go in and add those to this sheet that I've got. But I will get this sent out to you so that you can keep up with the ones that you've done and completed. But these are the dates that have come out. These are the dates that you can start taking their certifications. So we thought that this would be helpful for you. Josh, anything else?
No, just if you ever get stuck on a question, there's a lot of great AI things out there for you. And also, just remember you got Quizlet.com, all that good stuff. And then I'm sure we'll find a good study guide here and there. So all that good stuff, and we'll be ready for next year. Uh, Lisa, I just want to before you introduce him, I just want to say, um, today is very important what we're going to talk about because we're used to getting on here and talking about the MAPDs and all the different things, but he can correct me if I'm wrong, Demetri, but if somebody has more than one product with a client, that client's going to stick. And the product they're going to talk about today, it's so important because you relieve a lot of the fears that people have when they're looking at copays, going in the hospital, and a bunch of other stuff that they've souped up on this plan now. So, Lisa, you take it away. This is this. Thanks for listening to us.
So recently, we went to the NABIP conference and I met Demetri there. Demetri had a table and he was talking about the GTL product. That's what we always refer to it as the GTL product, but they have a lot of things that they offer. And I was talking to him and we wanted to bring him on so he could tell you all about the things that they offer. And I'm going to tell you a little bit about Demetri. Demetri Simos is his name, and he's been in this business for 22 years. He started out selling life insurance, and then he went to phone sales. So he's not new to this side of the sales process. He's been doing what we do. So that makes a big difference to me when you've had somebody in our shoes that's been out here selling. He was born and raised in Chicago, but says he's always wanted to move to the South. So he loves Alabama people and just wants to tell us a lot about what they have to offer. So I think it's going to be very interesting for you today to listen to him. We may want to bring him back for a little bit more time, but today he's condensed what they have to offer, and I think it's going to be interesting for you. So,
Awesome.
Demetri, take it away.
Awesome. Thank you, Lisa. Um, yeah, we're looking more and more to the south, that's for sure. Oops, I hit the save button, the share button. I'm going to learn how to use technology one of these days, guys. There we go. All right, so good morning, everybody. I appreciate the time. I know we've got, like Lisa said, this is going to be super condensed. This isn't to be a product training whatsoever, but it's more of a kind of kind of give you an idea of what GTL has to offer and how you can use it in general. One thing I can tell you about our products, I know you guys started off the call with your fun little topic about taking tests. You don't have to take any tests with our product to sell our product ahead of time. You can definitely get contracted. If you're not currently contracted, reach out to Lisa and she'll make sure you get you contracted with GTL and you get contracted. You go through a webinar to know what it is, and then you can go ahead and present it right off the bat. Um, so I guess being that I only got 20 minutes and being from Chicago, we talk fast, like really, so this might probably do me really good. It might be a benefit for being up here, but um, really what we're talking about, and you guys probably have been hearing a lot about this, is about diversifying your book of business. The situation of the past of being able just to write one product and that's it, those are getting to be tougher and tougher to be able to do and keep growing your business because of things that are changing, as you guys all know. Um, it's known, the P&C side of the house of insurance has been doing this for years. They know that if you can have a policy, two, three, four policies with particular individuals, they know that that person's not going to leave them. And that's really that's part of what we're trying to establish on our life and health side of our business, in particular senior market side. So a little bit about GTL, just to kind of get moving here a little bit for you. A little bit about GTL. We're a family-run business and have been since 1936. We have third generation of leadership today leading the company. So really, it's the grandson of the founder is the leader, the president, chairman, and CEO of the company, and consequently, there is a fourth generation that is in the confines in the building, working and learning the business, and eventually going to probably be leading the company down the road here. So we'll have four generations of running Guarantee Trust Life or GTL. We are a mutual insurance company, which has its advantages. Licensed in 49 states. Our AM Best rating is an A rating, and we've been doing innovative products for a very, very long time. So like hospital indemnity, for example, this was, that's probably the thing when Lisa said the GTL product. That's what she refers to as hospital indemnity, really. Everybody in industry knows the hospital indemnity as the GTL plan, really. That's kind of I take that as a pat on the back, that we've done a pretty good job from that perspective. One of the things I do want to talk about before I get into the actual product side of things, is that some of the things that I kind of like to touch on and make sure that we all understand, and I'm sure you guys understand it, but it's always good to hear it, right? The average savings account that a senior has 65 and above is around 8 grand. Not a lot of dollars. And what part of why we do what we do at GTL, I kind of consider us what we do is kind of like the Aflac of the senior market. We got simplified issue programs to help supplement the main health plans out there. Is it MedSup? Is it MA? We have options to be able to help folks cover the gaps because Medicare, as you all know, is not the end all be all for coverage. There is limitations to coverage and so forth. So, and if folks only have $8,000 in their savings account, I probably can promise you 100% that $8,000 is not intended to cover health plan expenses that isn't covered by Medicare or Medicare Advantage. They probably have other things they want to do with that. And that's where we come in, where we can help them with a small amount of monthly premiums, to be able to give them access to a significant amount of benefit. I was mentioning earlier about the benefits of cross-selling. I know we've all been hearing about this over the last couple of years in particular a lot, but this is all real why you want to cross-sell. From the basic perspective, for me, it's protecting your clients against other agents. You guys know it's very competitive out there. If you have an opportunity and if you're prospecting, for example, and you're talking to somebody and they say, let's say, well, I'll use Lisa for example here. Hey, Lisa, you've got, I'm here to talk to you about your Medicare option. And she'll say, oh, great. Oh, I got Medicare and I've got this Medicare Advantage plan. And that's a plan you keep her on. That's great. Then my next question is going to be, well, did your agent talk to you about how you can be protected against that $350 a day, 6-day copay for hospitalization? And the next part that comes out of that potentially can come out of that person's mouth is, what? I got what exposure? And so this way now it opens a door for another agent to protect them against the exposure that they had in the MA. And then now they gain that client through the hospital indemnity side of things. And then when it comes to AP, who's likely to get that client on the MA side too? The person that helped them that way. So there's things like that if you have the protection, if you have the gaps covered already, they're going to have less room for somebody to try to get in there is what happens when you do cross-selling too. It's going to increase your profit per client, which is also an important thing. You guys aren't doing this for free. We all want to make sure, for each person that we're offering to, each additional sale is an increase to the profit per client numbers that you could be looking at. But more importantly too, it's touch points. It can allow you to have touch points. And the more touch points you have, it gives you more opportunity to be able to ask for referrals. Because we all love referrals. And one thing I will say about referrals, don't always be asking for referrals for their age group. They do probably have kids that are 40, 50 years old, somewhere in that ballpark, 35, 40, 50 years old. There's things you can do to help folks that are on ACA with supplemental products. You can do a cancer plan. You may want to talk about life insurance if you do life insurance. There's other things you can do. And then even if somebody's 50, 55, 60 years old, you can even get into potentially that long-term care conversation, because that's a great time to have at those points. A lot of people wait till when to talk about long-term care, when they're on the verge of going into the nursing home. Oh, geez, I got to make sure I get this covered. Well, we got to do this stuff all ahead of time. And that's what these products are designed to do. Talk about it all ahead of time. It's going to be less expensive. Now, I'm not telling you from the long-term care perspective, you want to sell our product instead of a long-term care. Long-term care is the best option for folks, for sure. But if they can't qualify, or if it's too costly for them, we have short-term care options that you'd be able to take care of. Okay, so that's kind of the stuff that we, some of the benefits of cross-selling there. The product lineup that we have here at GTL in total, this primarily it's senior market focus for sure, but like I said, you can't go underage with some of these products. Hospital indemnities issue ages 40 to age 85. Cancer plans 18 to 90. Short-term care programs like Recover Cash, that's a nursing home product, great for a MedSup sale, because we all know MedSup covers for skilled nursing only. for 100 days. But a plan like a Recover Cash can help somebody have have protection if they go in for intermediate custodial care also, and you can go up to 360 days of benefit period, which is going to be a big help to people. It's simplified issue. There's also a home health care option on there. A really exciting product that people talk a lot about is a short-term home health care product. Short-term home health care doesn't matter if it's a Mets up sale or if it's an MA sale. That's a great program to talk about. I'll talk about that in a minute here, but it's it's a people product, like short-term care, Recover Cash, cancer, life insurance. Those are all people product. You've got somebody there they're talking to, you'll be able to talk to them about these products, no doubt about it. For me, when I think about hospital indemnity, I need to have an MA or some kind of plan to be able to try to cover that gap. Now, are you just confined to just doing it that way? No. Just because we talk about it at MA with hospital indemnity doesn't mean that if you have somebody on a Med Sup or a High G or something like that, or just Medicare Part A and B, they can't get a hospital indemnity too. They could. It's just part of all these products are really good for the creative side of what we like to do. I think a lot of us do what we do is because we want to be a little creative and trying to solve problems for our clients, and a lot of these products will take care of that for them. But I am going to only focus on two products, the high level wise, because again, it's not a training per se, but this is just to kind of give you an idea of what the plan could do for your clients. The issue rate.
Main.
Okay. Now our hospital indemnity plan we've had on the market since 2005. We came out with it when MAs first came out, and so we've had 21 plus years of experience with the hospital indemnity and MA market for sure, and it's been really good. It's been a product that's never had a rate increase or a benefit decrease for the insureds over the 21 years, and we're not even considering it going forward. So that's a big positive from that perspective. Um, you know, I'm going to tell you, like when we get to the point where we're doing trainings and so forth, I'm going to encourage you to make sure that you create your own package that you want to present to every single client. We can cover a number of different things when it comes to riders and base plans and so forth. You get hospitalization benefits. We don't distinguish between observation or confinement. So that means that if somebody's in observation for 10 days, for example, they'll get paid because they don't have those limitations on that. But we also pay a benefit if somebody gets hospitalized and discharged before 24 hours. If they get discharged between 6 and 24 hours, they'll get a hospitalization. Benefit periods are restorable unlimited number of times during a given year, and during over the lifetime. A lot of times the examples that I tend to use when we talk about the hospitalization situation, it's like, well, if the client has a $300 a day copay for 7 days, they ask the simple question, how do you feel about having to write a check tomorrow for $2,100? And most people are going to be like, they're not going to be too comfortable with that. And that's when I just tell them for $1 or $2 a day, I can show you a hospital indemnity plan that will cover this exposure for you. So it's very simple along those lines. It takes about 15 minutes to incorporate additional 15 minutes of total time to incorporate hospital indemnity with your MA. A lot of folks always ask, well, what is it that you do? How do you do hospital indemnity with MA? You actually present it during the MA conversation. So as you're going through the MA benefits and you're showing the exposures of the max out of pocket in particular, that's when you say, oh, I'll show you I can protect that with a hospital indemnity plan. And that's all you say. Okay. So then I'm going to switch over I'm going to leave that there for from a hospital indemnity perspective, just to be cognizant of time here for you guys. And then once you kind of get into that cycle of redoing hospital indemnity and MA together, now the follow-up conversation for your client could be a short-term home healthcare conversation. A short-term home healthcare product is really nice. And what it does is it has 3 plan options. It'll provide benefits if the client can't perform 2 of the 6 ADLs or have a cognitive impairment and have a plan of care. But then it'll also have a prescription drug benefit attached to it, which has a $10 benefit for generic and $25 for brand, up to a yearly limits depending on the plan they choose. And what ends up happening is that yes, we're offering this plan because it'll provide protection for home health care. Which, why is that important? Well, because home health care is not covered very robustly when it comes to the Medicare side of things. It's very limited coverage when it comes to home health care. And I would imagine every single one of us on this call, if I were to ask you, would you want to get treated in a facility or would you want to get the treatment at home? All of us will say we want to get it treated at home. So I think your clients would be very similar. And so now we have a way here that we can provide benefits, of up to a maximum of $162,000 from a 360-day benefit period perspective, and be able to get back money for prescription drugs that you're getting filled, which then offsets the cost of the annual premium. So your net effect of your premium for a client that's 65 years old could be around $6, $7 a month. So it becomes very affordable, simplified issue. The hospital indemnity has guarantee issue in most states. Like in Alabama, for example, your guarantee issue in hospital indemnity is 64 and a half through age 74. So there's a very simple conversations that you can have here. You're not going to get bogged down with the underwriting side of things. One of the things that I think is important, I know I'm just doing high level here from what these products do, but what's important, I think, is how do you submit apps? That's probably one of the simpler things to talk about. Real quick though, too, this is our main website, gtlic.com. If you go under agents, click on state approvals, you'll see that if you do have non-resident licenses in other states, so I know all y'all are in Alabama right now, but let's say you have clients in Mississippi or Georgia, you want to see what's available for your Georgia clients, you can just click on the state. It'll tell you all the products that are available in that state for that person. So before you call them, you kind of have an idea what you want to have that conversation about with them. I know this doesn't show it to you in a color format, but just so you know, hospital indemnity wise, it's available in 43 states. The only state we don't have it in is going to be Vermont, New Hampshire, New York, DC, New Mexico, California, and Alaska, just so you kind of have an idea there, just for that perspective. And then something that's really good, I think, is our agent portal in terms of we just updated this just recently, just this past weekend, actually. Now we're also using multi-factor authentication. That's why if you have been using GTL prior to, in the past, this looks a little different. So if you're writing business, you're going to use this as your login right here. And then you just, to go ahead and log in. And then the first thing you're going to see here is going to be, your initial pages. Some of the things to help you guys be able to have conversations with your clients that I think is important and that this can do for you is if you click on our Access GT Link button, I should go back and show you where that was. I did that fast. If you come right down to the bottom, the fourth box down here, Access GT Link, I click it, another tab will open up on the browser. And right in here under consumer marketing, so in Alabama for hospital indemnity, you have Advantage Plus Elite with the GPO option. Right down here is a consumer product video. And if you recall on the brochure that I had on the screen earlier, there was a QR code. That QR code will also bring you to this, will also give you a version of the video too. But the purpose of this video that can be done, a couple different things you can do with this. And we have this also for our cancer, our short-term care programs. You can use this video, to maybe send out an email blast to your clients. Say, take a look at this. I'm going to call you regarding this. Just want you to be prepared. Or a lot of folks, when they're talking about during their MA appointments and they finish their MA application, they want to transition to hospital indemnity, they'll play this video for the client. And this video is, I want to say, like 2 minutes and 25 seconds or so long. And they'll play this video and give them a really good high level understanding of what the program is going to do, and then allows you just to go right in, present your option of what the protection they need, and then be able to go right into the application process. So this video, you can download it. So if you copy this link right here, you can put it into social media if you'd like. You can put it on a website if you have a website for your agency. If you want to put it, like I said, and attach it to an email, you can download it. A number of different ways it can be utilized. This is all these videos are consumer facing, so it helps help the process be a little easier for your clients. All right. So also, if you also take a look, whenever you're in our e-app, you want to make sure you navigate through these three symbols here, the three lines, hamburger symbols, I guess they're called. If you ever need to order supplies, just come right here, click on supplies there. If you need to look at a pre-recorded webinar, agent trainings are in here if you ever need them. But The other thing that's a pretty neat tool that's going to help you with the MA conversation along with the hospital indemnity is something that we call a fill the gaps tool. So if I was on the phone with a client or face to face with a client, I'm on our website here, and I'll click on Alabama, and then let's just say we just do Baldwin County. That's because it's close and easy there, and it's going to retrieve all the carriers that have an MA plan in that county. So if your client tells you that you have, that you have a Humana, that they have a Humana plan, and they are on the Humana plan, I don't know, whichever one. We'll just use this one here, the PPO. So this will tell us now, okay, well, the client's on a 210 copay for days 1 through 4. Ambulance copay is 335. Skilled nursing is 220. And then these are some of the things that we can cover up with a hospital indemnity plan. So then it's more of a kind of visual kind of help understand what the options we can help with. Now from here, what could happen is that if you choose to want to go ahead and quote it, you just click on apply for applicant and just input the client's information on the quote screen here. It'll already have Alabama filled in there for you. So when you click on next, it's gonna pre-populate with the plan information that the client has currently. Okay. So you can take things off that you don't want to add, it's not gonna be part of the package that you want to present to your clients, whatever that may be, and then you can just present them this number, then they go from there. Or if you want to make adjustments to the, because you want to offer them a little bit more on the cancer side with recurrence, sure, not a problem. You can do that. Then whatever they tell you, then you can remove whatever the client doesn't want, and then you can just make adjustments along the way very simply, and then you just click on apply, and then you can go right through to the application process. So that kind of makes that process real simple. Now, also, I want to show you just to kind of give you an idea here. Right here. That's where I was going to go. I wanted to show you because I know I don't do a good job unfortunately, of kind of illustrating the short-term home healthcare plan. But this will do a great job. It's a digital brochure that's available through consumer marketing. And this is what the home healthcare plan looks like. I know it's probably hard to see, but I'll make it a little bigger. And so there's 3 plan options. A is going to be the least amount of benefits, least amount of cost for the client. C, the most amount of benefits, most amount of cost. Then there's a prescription drug benefit here. There you go. And then, so you can see plan A can get up to 300, 600, or 900. And there is home health aid is also part of the home health care benefit. So they'll be able to get benefits for a home health aid. This is a 360-day benefit period. It doesn't have to be done in a calendar year. So I do that to be able to flip back to the quoting tool to kind of give you an idea here. Where'd it go? There it is. So if I wanted to quote short-term home health care, and I just wanted to put on here option A, and I'm using a 66-year-old individual, I believe. That's what I normally do. Yep. Okay, good. So a 66-year-old individual, and let's say, for example, I want to deselect hospital indemnity. I don't want that at all. I could just remove that altogether. So the premium for a short-term home health care for a 66-year-old, which is an attained age product, would be $30.93. So if I took that $30.93, I know I can hit the annual button up on top, but I'll do it this way. The annual premium is $371.16 for a plan A. Now, if they got back the $300 for prescription drugs, so they have $71 really that they're paying out of pocket. If I were to divide that by 12, that's going to be less than $6 a month to be able, to have home health care coverage. Now, again, the rates are attained age based on age bands. So at age 71, it will go up. At age 76, it'll go up. At age 81, it'll go up. And age 86 will be the last time it goes up. But it's still going to, with the offset with a prescription drug, it provides a great coverage for your clients for the clients at that point. So a lot of real easy process. Things get issued quickly, and then the thing that we do really good at is we pay claims pretty well. So that's one of the things that it's important because we want to make sure that the clients are happy, and they're happy when they get paid claims that we're supposed to be paying for. So I know I did this quick, but if you do have any questions about anything, I will, if you do have any potential questions and such, sales support can answer questions in terms of product stuff. 800-323-6907. They're here Monday through Thursday from 7 to 5, and then on Fridays from 8 to 12 Central Time. So, Lisa, appreciate the opportunity to say hey real quick, and hopefully this kind of gives you all an idea how it can be beneficial for you to have the hospital indemnity plan matched up with the MA, but then also to be able to add another potential option with short-term home healthcare.
Yeah, absolutely, Demetri. Thank you so much. And I just wanted to touch base on the fact that the hospital indemnity plan was guarantee issue from 64 and a half to 74. Is that correct?
Through age 74, yes.
Yeah, that's crazy. So, what an easy sell to add to your MA plan. So, it helps you make more money and it also helps your client just retention. So a lot of things there, but if hopefully one day we'll be able to have a longer webinar with Demetri and go through the products a little bit easier for you. But Demetri, thank you for your time today. We really appreciate it. And we are going to move on to the ACA portion of the call. So thanks everybody for joining the Medicare part, and we appreciate you being here. Heather?
Thank you, Lisa.
Yeah.